So this is your water pick. It's pretty much like your mini water pressure for your mouth. It's one of the best tools in cleaning your All-On-4. So you'll notice there is a dial with pressure settings from 1 through to 10. Start on 1, you will build up eventually to 10. So take it gently, work with what feels comfortable. Besides having the mains on-off switch, you've got an on-off switch on the side of the unit, as well as one on the actual handle. So you want to fill up your reservoir, pop in one of the tips, and there should be a few of them in the box to get you going. Then we start blasting away all those little bits and pieces that get stuck, particularly around your sutures. So you'll notice here, go up nice and high, lift the lip out of the way, and you want to aim for that little gap between the gum and the bridge and just really blast it all through until the water's nice and clear. When you're starting out using your water pick, you will get your mirror, you'll get your wall, you'll get the grout. That's okay. You'll figure it out pretty quick. And it's the same thing again with the bottom. You just want to lift the lip out of the way and aim for that gap between the bridge and the gums. You can also go in from the tongue side as well and blast in and get anything out from the other side. It is a little bit trickier because you do tend to get water flowing out more. Then with your brushes, you've got 3 different types. You've got your really nice thin one, which is really good for the lip and cheek side. So again, we're just aiming to keep those implants nice and clean. So you want to lift the lip out of the way, brush in that little gap. Unlike your natural teeth, your All-On-4 can't get decay. The only thing that we're really trying to prevent is that bacteria getting in there and causing any sort of bone destruction. So if we keep the bacteria away and any soft bits of food, we can stop things going pear-shaped. Next little brush that we're using is really good. It's got a little angle, so it's great for the tongue side. In this little spot, you're going more by feel because you can't really see where you're going, so you're just aiming to gently massage over the gums. And if you try and visualize, you've got your 4 implants. Normally the 2 in the middle are roughly in line from the second from the middle teeth. And then a couple of teeth towards the back to where your premolars are, that's where those next implants will be. And the most important thing for the most healthy looking implants is your floss. So you have a little fishing line end that you feed in nice and close to your implants. You have a little extra bit of space. Stick with those front ones. So you want to go in nice and close to the second from the middle teeth again where those implants are. And when you're bitten together, lift the lip out of the way. You want to gently thread it through. And then once you feel it poking you in the tongue, you can use your tongue to flick it back at yourself. And then you can pull it on through and it's like you're polishing a boot. You just want to gently polish along the teeth, hug the implant on one side like a little C shape, floss back across like polishing a boot, get the implant on the other side, let go of the soft end and pull through. Then we'll get you to bite together again and go just to the right or just to the left depending on which implant you're going to. So there's 3 spots to thread through, top or bottom. And the most important thing with the flossing is don't start flossing until all your sutures are gone. Otherwise you will not enjoy the experience because it will pull and drag and you will not like it. When you're flossing the back of the bridge, you don't need to thread in underneath. You just want to hold it bridge width apart, head in underneath like you're polishing a boot again. Get to the back implant, hug it like a C shape and back out again. So be kind to yourself and start off with the water pick and brushes first, and then we'll get you on to the floss. And if you're still struggling, we can always show you in your own mouth as well.